Meantime, health officials are taking the threat posed by the novel coronavirus seriously and are urging Bahamians to do the same. Amidst concerns the country may lag in its ability to test for the potentially deadly virus, Dr. Sands shared that officials are increasing their capacity. Here's Cleopatra Murphy.
The country now has 3 confirmed cases of the novel coronavirus or COVID-19, and with those numbers expected to increase, health officials are making efforts to increase testing capacity. Minister of Health, the Honorable Dr. Dwayne Sands, says health officials currently have 750 test kits available and another 5,000 to 6,000 have been ordered. The Minister of Health advised Parliament that the 61-year-old patient 0 is hospitalized and stable, while 30 people she was in contact with have been identified. He further detailed efforts to detect, detain, and contain the novel coronavirus now that 2 others have been confirmed to have the infection.
Today we began the task of doing the contact tracing on those positive cases. So, Mr. Speaker, this first case triggered the operationalization of our health disaster plan and the full activation of the Health Emergency Operations Center, our EOC.
The Minister of Health says healthcare providers have transitioned from preparedness to response, and health services have been retooled to redirect staff to respond to the health threat. The national COVID-19 website, covid19.gov.bs, also went live today. More than 217,000 cases of the novel coronavirus have been diagnosed globally. Nearly 9,000 deaths have been recorded. Sands says Bahamians can determine the virus's local impact.
The steps we take now and in the days ahead will determine the degree of spread of coronavirus in the Bahamas. We all have a role to play. We strongly urge all Bahamians to follow proven public health advice by closely adhering to the following recommendations. 1, we want you to maintain a distance of at least 3 to 6 feet between you and others. This is what we mean by social distancing.
Along with avoiding crowds, Sands says avoid public transportation, disinfect surfaces regularly, wash hands with soap and water regularly, and use hand sanitizers with at least 65% alcohol where water is not available. He also issued caution for the more at-risk population.
Stay home if you're sick. Stay home if you are at higher risk of being infected with COVID-19. These people include the elderly, those who have diabetes, hypertension, lung conditions such as asthma, persons with heart disease and kidney disease. And this also refers to those who already have a weakened immune system, such as cancer patients, those on high-dose steroids, pregnant women, and those who are morbidly obese.
The minister says healthcare professionals are prepared to tackle the potential healthcare crisis and should be commended at this time. People showing symptoms or who may be concerned that they may have the novel coronavirus can call hotline numbers 376-9350 from 8 a.m. to 8 p.m. and 396-9387 between 8 p.m. to 8 a.m. Cleopatra Murphy, ZNS Network News.